We've all been there. A tickle in your throat turns into a nagging cough. Most of the time, we brush it off as a common cold or allergies. We pop a cough drop, hope for the best, and go about our day. But what happens when the cough lingers? When weeks turn into months, it's easy to get used to the constant hacking. We might even start to believe it's just how we are now. This is where the danger lies. Our bodies communicate through symptoms, and a persistent cough is a signal we shouldn't ignore. While it's often harmless, a chronic cough can sometimes indicate a more serious underlying issue like lung cancer. Lung cancer, a leading cause of cancer deaths worldwide, often presents with subtle symptoms in its early stages. One of these subtle signs is a persistent cough that just won't quit. By understanding the potential seriousness of a chronic cough, we empower ourselves to take action and seek medical advice when necessary. Early detection is key when it comes to lung cancer, and recognizing the warning signs can make all the difference. Before we delve into the specifics of lung cancer-related coughs, it's important to understand why coughs happen in the first place. Coughs serve as a protective mechanism, clearing our airways of irritants and foreign substances. They are incredibly common and often stem from benign causes. Upper respiratory infections like the common cold or flu are frequent culprits behind coughs. These viral infections irritate the airways, triggering a cough reflex. Allergies also play a significant role. When our immune system overreacts to harmless substances like pollen or dust mites, it can lead to inflammation and coughing. Other common causes include postnasal drip. Excess mucus dripping down the back of the throat can tickle the airways, leading to a cough. Asthma. This chronic respiratory condition causes airway inflammation and narrowing, often resulting in wheezing and coughing. Gastroesophageal reflux disease, GERD, acid reflux, where stomach acid flows back into the esophagus, can irritate the throat and trigger a cough. Medications, some medications like ACE inhibitors for high blood pressure, can cause a dry, persistent cough as a side effect. Recognizing these common causes can help us differentiate between a cough that's likely harmless and one that might warrant further investigation. Certain cough characteristics can raise red flags. Consult a doctor if you experience these signs with your cough. 1. Hemoptysis or coughing up blood. This is a serious symptom. 2. Unexplained weight loss. Sudden weight loss can be a sign of cancer. 3. Persistent chest pain. 4. Shortness of breath. 5. Hoarseness or voice changes. 6. Wheezing. 7. Swollen lymph nodes. 8. Chronic fatigue. These signs should be evaluated by a healthcare professional. Sometimes it's not just the presence of specific symptoms, but a change in your usual cough pattern that can signal trouble. If you have a chronic cough that you've become accustomed to, pay close attention to any shifts in its characteristics. Cough intensity. Has your cough become more severe or frequent? Cough sound. Has the sound of your cough changed? Does it sound deeper, raspier, or wetter? Mucus production. Are you coughing up more mucus than usual? Has the color or consistency of the mucus changed? Response to medication. Is your cough no longer responding to medications that used to provide relief? These subtle changes can be early indicators that something isn't right. Your body is trying to tell you something, and it's crucial to listen. Section 5, more than just a tickle, distinguishing lung cancer cough from other ailments. Distinguishing a lung cancer-related cough from coughs caused by other conditions can be challenging, as many symptoms overlap. However, there are some key differences to keep in mind. Persistence. While coughs from colds or allergies typically resolve within a few weeks, a lung cancer cough tends to be persistent and worsen over time. Severity. Lung cancer coughs can be quite severe, often described as deep hacking coughs that are difficult to control. Associated symptoms. Lung cancer coughs are often accompanied by other concerning symptoms, such as unexplained weight loss, chest pain, shortness of breath, or coughing up blood. Risk factors. People who smoke or have a history of significant exposure to secondhand smoke are at a much higher risk of developing lung cancer. If you're concerned about your cough, it's always best to err on the side of caution and consult a doctor. Section 6. Sounding the alarm. Cough-related symptoms that warrant immediate attention. While it's important to be mindful of any persistent cough, certain cough-related symptoms require immediate medical attention. These symptoms can indicate a medical emergency and should not be ignored. Coughing up large amounts of blood. This can be life-threatening and requires immediate medical care. Sudden shortness of breath. Difficulty breathing that comes on suddenly or is severe can signify a serious problem with the lungs or heart. Chest pain that spreads to the jaw, arm, or back. This type of chest pain can be a sign of a heart attack and requires emergency medical treatment. Confusion or disorientation. Sudden confusion or disorientation can be a sign of a medical emergency, such as a stroke or severe infection. If you experience any of these symptoms, call 911 or your local emergency number immediately. Section 7. Time matters, understanding the importance of early lung cancer detection. When it comes to lung cancer, early detection is paramount. The earlier the cancer is caught, the better the chances of successful treatment and survival. Unfortunately, lung cancer often doesn't cause noticeable symptoms in its early stages, which is why it's crucial to be aware of potential warning signs and seek medical attention promptly if you notice any changes in your health. Early-stage lung cancer is often more treatable with surgery, where the cancerous tumor can be surgically removed. As the cancer progresses to later stages, treatment options become more limited and less effective. Regular checkups and screenings are essential for high-risk individuals, such as smokers and those with a family history of lung cancer. These screenings can detect lung cancer in its earliest stages, even before symptoms appear, significantly improving the odds of successful treatment. The power of prevention, how regular checkups can save lives. Prevention plays a vital role in the fight against lung cancer. While not all risk factors are within our control, we can take proactive steps to reduce our risk and improve our overall lung health. Quit smoking. Smoking is the leading cause of lung cancer, and quitting is the single most important thing you can do to protect your lungs. Avoid secondhand smoke. Secondhand smoke is also a significant risk factor for lung cancer. Test your home for radon. Radon is a naturally occurring radioactive gas that can cause lung cancer. Test your home and take steps to reduce radon levels if they are high. Maintain a healthy weight. Obesity increases the risk of several cancers, including lung cancer. Eat a healthy diet. A diet rich in fruits, vegetables, and whole grains can help reduce cancer risk. Get regular exercise. Physical activity has been linked to a lower risk of many cancers, including lung cancer. By making healthy lifestyle choices and getting regular checkups, we can significantly reduce our risk of developing lung cancer and improve our overall health and well-being. Don't wait and see when to seek medical advice for your cough. Knowing when to seek medical advice for a cough can be tricky. While most coughs are harmless and resolve on their own, some coughs warrant a doctor's visit. Here are some general guidelines. Cough lasting longer than 3 weeks. If your cough persists for more than 3 weeks, despite home remedies, it's essential to see a doctor. Cough accompanied by concerning symptoms. If your cough is accompanied by any of the red flag symptoms mentioned earlier, seek medical attention promptly. Cough that disrupts sleep or daily activities. A cough that significantly impacts your sleep or daily life should be evaluated by a doctor. Cough that worsens or changes. If your cough suddenly worsens, changes in sound, or becomes more frequent, consult a doctor. Any concerns about your cough? If you're ever unsure about your cough or have any concerns, it's always best to err on the side of caution and see a doctor. Taking control of your health, empowering yourself through knowledge and action. We've covered a lot of ground, from the common causes of coughs to the warning signs of lung cancer. The key takeaway is this: knowledge is power. By understanding the potential seriousness of a persistent cough and recognizing the red flags, we empower ourselves to take control of our health. Don't be afraid to advocate for yourself. If you have concerns, voice them to your doctor. Ask questions, seek clarification, and be an active participant in your health care. Remember, early detection is key when it comes to lung cancer, and your proactive approach could save your life. A final word: your health is your wealth. Listen to your body's signals. In the hustle and bustle of life, it's easy to ignore our body's signals. We push through discomfort, dismiss subtle changes, and convince ourselves that everything is fine. But our bodies are constantly communicating with us, and a persistent cough is one signal we shouldn't ignore. While it's often nothing serious, a chronic cough can sometimes be a sign of something more concerning. By paying attention to our bodies, understanding potential warning signs, and seeking medical advice when necessary, we can take charge of our health and well-being. Remember, your health is your wealth, and it's worth protecting. Like, share, and subscribe.